I want to welcome everybody. This is the largest group we've ever had. I hope that this is going to work out with Facebook Live. I want to welcome our guest, Daniel Corcos. And let me just quickly tell you how I found out about him. I got a call from a friend in Chicago who said that somebody sent him a video where he mentioned me. And I'm like, what? And so they send me the video, and he was doing a talk about exercise and Parkinson's. And he was looking for websites. And he says, and I found this lady who calls herself Twitchy Woman. And she does all these programs on Sunday mornings. And I was just like, okay, I've got to find this person. So he lives in Chicago. He's at Northwestern University. My daughter lives in Chicago. So the last time I was there, we met for lunch. And we had a wonderful lunch. And here he is. Thank you. Go ahead.
Okay, Sharon, thank you very much. Thank you very much for inviting me to let you all know anytime you're in Chicago and you like lunch, I happen to love lunch. And I see one of you actually is from Chicago and comes down to Northwestern to see her physician. So you know where to find me. So I'm going to talk to you all today about the exercise prescription for Parkinson's disease. And we know the exercise prescription for Parkinson's disease, and we know it very well. Normally, when I give presentations on my opening slide, I have both men and women. Turns out Parkinson's disease is more prevalent for men. And there are several very, very famous men who have Parkinson's disease, but I'm not speaking to men. And you'll be doing very, very, very well if you get these three people. So good. Now you can see the person on the left is Deborah Kerr. The person in the middle is Janet Reno. And the person on the right, working on the presentation, and my lovely wife came by and she said, oh, everybody wants to see Neil Diamond. So we added Neil Diamond. So Parkinson's disease is a disease that is associated with many, many famous people, and it's getting more and more prevalent. So first of all, I'm going to talk to you about the epidemiology of Parkinson's disease, what we learn just by studying the population. No experiments conducted here. We just look at what happens to the population. And so the evidence is clear that those in midlife who routinely engage in moderate to vigorous exercise have a lower risk of developing Parkinson's than those who don't. And implicit in this is the idea that exercise is good for you. Cardiovascular fitness is important, and it's associated with better cognitive and motor scores in those who have Parkinson's disease. And the other thing is that longevity in Parkinson's disease is associated with increased physical activity. Now, there's a very, very famous doctor in Madrid, Jose Obeso, and when he sees people who come into him, the first thing he says is, let's worry about your health, and then we'll worry about your Parkinson's disease, because the better your overall health is, the better you are able to deal with the Parkinson's disease. And so he talks about general fitness. And when you're fit, you are better able to overcome other age-related problems that can complicate PD. PD is associated with a balance problem. If you have a vestibular problem superimposed on Parkinson's disease, that's not great. Neuropathies, spinal stenosis and lower back pain. Lower back pain is more prevalent in people with Parkinson's disease. Arthritis, osteoporosis is very prevalent. And it's one very important reason to exercise. And I'm going to tell you about an osteoporosis study at the end of my talk. And then if one has a disease like Parkinson's, one's not immune to having a stroke or a complication or what is technically called a comorbidity. And when I'm talking to as many as 100, 200 people, you're all going to be profoundly different, ranging from those who embrace vigorous exercise to those who find the E word just not part of their vocabulary. And so if you don't like the E word, just think about activities, because activities are good for fall risk, balance, and mobility. Now, what does it do for you? Okay.
Okay, excuse me, Daniel, are you changing the slides because we're not seeing it?
I am changing the slides.
Go to view.
Hang on a minute.
Slideshow, there you go. Okay.
Well, let me try again and see what's happening.
Yeah, you have to go to slideshow.
Is it changing?
Yeah, well, yeah, we have exercise can help symptoms.
It changed
Can you
once.
click on slideshow, and then you should be able to show it. It's just
Well,
click each slide.
hang on a minute.
There you go, general fitness, there you go.
Yeah, I mean, I can present like this, but it's not the way it's.
No, click slideshow at the top.
Yes, that's what I'm doing.
No, it says animation. Okay, there you go. No? All right, try view.
I'm not sure what you mean by
Okay.
view.
At the top of your screen, let me see if I can change it. No, I can't. At the top of your slide,
I'll tell you what.
No.
Okay. Are you able to see this?
Yes.
Yes.
Then
Yeah.
then I'll just go from this. It's not ideal, but so I've been through.
Okay.
Can you all see exercise can help symptoms of Parkinson's
Yes.
disease?
Yes.
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 Okay.
Yes.
So what exercise does can improve cognitive function, and the end stage for some people, not all, but for some people, is dementia. And so this is good. It can improve depression, improve sleep, which is impaired, decreases constipation, decreases the kind of general global fatigue associated with Parkinson's disease. Clearly you get fatigued when you exercise, but the general sense of fatigue is reduced. It stops or slows osteoporosis. It improves motor performance by improving strength, balance, posture, and gait. And you get improved drug efficacy. Now, one of the things that research scientists, physicians, people with a disease hope it does, it hopes that it protects the brain against decline. Now, as one age, there's a generalized decline. When I had Parkinson's disease, there's a generalized decline. But the more we can prevent that, the better. And that's what's meant by neuroprotection. And so what does exercise do? Well, Parkinson's disease is a disease of dopamine deficiency. You're producing less dopamine in substantia nigra pars compacta than is ideal. And any way we can increase dopamine is good. For those of you on Sinemet, levodopa, that's dopaminergic medication. You can raise your dopamine levels within endogenously, and that is good for you. It increases nerve growth factor. There's something called brain-derived neurotrophic factor, which is lower in people in Parkinson's disease and gets elevated with exercise. It increases the blood flow in the brain, and the brain is where the nerves are. The nerves need nutrients and oxygen, and they get that from brain. It promotes beneficial changes to the brain immune system. The evidence is really quite clear that when people have Parkinson's disease, there's an increase in inflammation. A lot of inflammatory markers are elevated, and exercise reduces that. It decreases oxidative stress. It increases nerve connections, and it may increase the production of new cells. Now we're going to get a bit sciencey, okay? So Sharon told me that you are the single most sophisticated audience in the world. And if I just say a few words, that's not what people want. So we're now going to start looking at some data, and I'm going to walk you through it slowly, and you can put questions in the chat. Now, nearly all, if not all of you, have been to your physician and they will assess your degree of Parkinsonism. They use something called the Unified Parkinson's Disease Rating Scale. It has 4 parts. The part I'm presenting here is the motor section of the Unified Parkinson's Disease Rating Scale. And so if you've got tremor, and if you've got bradykinesia, and you've got rigidity, and you've got abnormal postural reflexes, they give you numbers for that. And the higher your number, the more severe your Parkinson's disease is. And what we have here on the x-axis is 24 months. This was a 2-year study of progressive resistance exercise conducted over 2 years. And we compared a group which just did gentle stretching and balance. It's called fitness counts, with a group which did very, very vigorous progressive resistance exercise. And what you find is, first of all, if you look at this dot, that is the natural disease progression taken from the literature. I did not have a control group who did nothing. So all of you, if you do nothing, your disease progresses 3, 4, 5, 6 points a year. Varies from person to person, but it progresses. Many people, not really most of you, because you're the kind of the sophisticated audience who really probably doesn't even need to hear from me. The people who really need to hear from me are those that I can never contact. But if ever any of you develop outreach programs to communities, I'm happy to talk to those. And so what you find is most people do nothing. And so when they go out into a gym, we gave them a personal trainer. It was light, easy stretching. They still do very well. In any exercise program, the biggest change is something against nothing. So for those of you who don't like to do a lot of activity, anything is good for you. That's the most important takeaway message. But you'll see, so this is a change score from baseline. So at baseline, the change score will always be 0. At 6 months, people are 6, 7 points better. That means they have less tremor, less bradykinesia, less rigidity, and less posture. The group which was only doing the fitness counts ended up back where they were. So their score hadn't changed that much over 2 years. The group who did very, very vigorous progressive resistance exercise improved by about 7 points, or over 10 points compared with their disease progression. And I know it's my paper, and I try very, very hard to look at everybody's paper equally. I always try to present a balanced picture. And I know this is my study, but I think it's the best evidence to date for resistance exercise reducing the signs of Parkinson's disease. So the signs are what the physician assesses. And one of the things I want you to take home, I know we had a personal trainer, and I know when people enroll in a study, they feel a very strong allegiance to their physician. I know all the reasons why this is not the real world, but we had 40 people who have Parkinson's disease do resistance exercise for 2 years. And we only lost a very, very small number. So it's doable. Now, colleagues of mine in Brazil and I worked together on a more complicated form of resistance training. And this is not really something you can easily do on your own, but for those of you who have access to a trainer or a gym which can provide some help, these instability exercises are really, really very, very good for you. And if ever you ever go to physical therapy, you'll probably find they've got all kinds of instability devices. So an instability device is like this diner cushion here. So it moves, and this ball moves. So when you're doing your squat, you don't actually need very much weight. So this is very good for your posture and your balance. And what does it do for you? Well, Many of you would have had the Montreal Cognitive Assessment. And if you have a score of 30, that means you're cognitively normal. If you go below 26, you have mild cognitive impairment. And you'll see here a group of people with Parkinson's disease with mild cognitive impairment. They do this resistance training and instability, and most of them go above mild cognitive impairment back into the normal range. And I'm not sure anybody has got stronger evidence for improving cognition than this data set. In 2018, I published the results of what we now call the SPARKS-2 study. We had 128 people in early stage Parkinson's disease who had not yet taken dopamine. We did high intensity treadmill exercise, 4 days per week, 80 to 85%. We did moderate intensity, 4 days a week, 60 to 65%. So the difference between 80 to 85% is if you go out onto a treadmill or you go for a really vigorous walk at 80 to 85%, it is not at a conversational pace. You're really working out. 60 to 65%, you can chat about anything. It's just a nice, good walk. And then we had a waitlist control because we wanted to see disease progression over 6 months without an intervention. And then we assigned the people to either of the other 2 groups to make sure that everybody could take part in the study. And after 6 months, the high intensity group had a 0.3 change in their MDS Parkinson's disease rating scale, and the control group had a 4-point change. You can see this really quite dramatically in the graph. So over 6 months, there was virtually no change in the MDS UPDRS. In the usual care, there was a 4-point change. And this is a big deal, okay? Now, I'm very fortunate. I get emails from people, and I'm gonna walk you through Javella. Now, I checked with Javella yesterday if I could share her information with you, and she said, sure, she'd be honored. Well, I'm actually honored to be able to share it with you. And this is not an isolated case. So, good morning, she said. I just wanted to reach out and say thank you so much for this study. That's the one I've just shown you. It has fueled me, empowered me, and encouraged me to fight Parkinson's disease like a warrior. While I don't qualify for your new study, which is called SPARKS-3, which I'll tell you about, I'm testament to the positive effects of your research. In October 2015, at the age of 51, I was diagnosed with early onset Parkinson's disease. I'm now 58. My medication, Azilect NeuroPro, and italicized exercise. I go to work out at least 5 days a week since reading about your research in 2017. I celebrated my 1500th class this week on December 21st. You sent me some wonderful pictures, okay? Mission possible. Today was a major milestone for me. And you'll see her here. So this is Janella, and that's 35 pounds, okay? That is some impressive weight training, and it can be done. And I'm not going to explain to you exactly how she was in 2015, but she wasn't looking like that. She was tired, overweight, and stressed to the max. She had family issues as well. Thank you again to More Life, okay? So here she is, okay? On the left, she's working out, and on the right, she was ready to go out with her husband. And she came a long way after her diagnosis, and it shows you what you can do. Now, skilled exercise is also very good. So some people really don't like the E word, but you mentioned to them the dance word, and this is exciting. And there's compelling evidence that dance improves the disease symptoms, reduces fall risk. When I had this on the normal presenter mode that I do, DIVA was going to flash up instead of just appear there. But it came right up here. And so the bottom line to all of you is, why not be both a warrior and a diva? They're not mutually exclusive. Now, I noticed when I was looking in, and I'm always a little bit concerned if I ever put up a picture of somebody like Janella, who's early onset, 51, and who really has embraced, vigorous exercise, that the view is, well, this isn't for me and it doesn't apply to me. We're all different. We're all different. Now, this is my favorite picture by a long way. And people love Rocksteady Boxing. I would bet significant money that some of you go to Rocksteady Boxing. Most of you would have heard about Rocksteady Boxing. And, you just look. They're a good-looking, happy group. And the bottom line is, when you see this picture, what you learn is you can either let the disease take ownership of you, or you can take ownership of the disease. And when I look at these people, I see people who are empowered and have taken ownership of the disease. So the exercise prescription and dose is very clear. It's weight training twice a week. The effect size, and from meta-analysis, don't worry about it. It's technical. It just means that lots and lots of studies have been looked at. They've all been averaged together. That's why it's called a meta-analysis. And a 0.5 means it's a medium effect, like it works. Endurance training 3 times a week. I'm always asked about high intensity interval training. There's no research evidence for Parkinson's disease, but I'm sure it's good for one. And for those who prefer it, some HIIT is good, but there's something very good also about keeping the heart beating at a sustained rate. And then balance training is very important. For those of you who've only just been diagnosed and your posture and balance is great, the likelihood after 15 years that it's not is quite high. And so the sooner one starts to work on it, Tai Chi, yoga, dance, balance. And then sometimes you may end up with a specific problem, which I call a task-specific deficit. So if there are 100 people listening right now, a percentage of you will freeze. And freezing needs to be treated by a very, very skilled therapist who has expertise in giving one ways of helping freezing. And that requires specific focused intervention, as opposed to most of what I'm talking about is just generally looking after yourself. I'm a professor of physical therapy, and so I teach all my physical therapists both the benefit of the sustained exercise and then the very task-specific. Similarly, a percentage of you will have a quiet voice, hypokinetic dysarthria, and so you will need to see a speech-language pathologist. This book is a little complicated. I wrote, based on work of my colleagues previously, the chapter 11 on Parkinson's disease. For those of you who are really quite sophisticated in exercise, you'll enjoy reading it. For those of you who work out with a personal trainer, you can certainly make your trainer aware. This is the kind of the Bible of exercise prescription, and it works it through very, very detailed. And for those of you who are very sophisticated, you can find it on Amazon and other places. Some of you also may be involved in groups and do outreach. I've worked very, very hard with both the Parkinson's Foundation and American College of Sports Medicine to produce documents like this to help people. They're still a little bit complicated. And so they also produce documents like this. And so if you ever get a chance, to work with people who can't listen to talks like this and who just need some kind of simple guidelines, there is this document. And then before we take questions, I'm just going to make a pitch for a couple of studies. So I'm the principal investigator of SPARKS 3. It's a NINDS, National Institute of Health funded study for endurance exercise. It's the follow-up to Sparks 2. You can read all about it on our webpage. Won't apply to most of you. When you study neuroprotection, you really want to study people before they take medication, because the medication can affect the disease trajectory. So this is for people who've only had the disease for 3 years or less and are not taking symptomatic medication. But anything you can do to help me recruit would be really, really great. And then I'm going to put in a plug for my colleagues at the University of California, San Francisco, Doctors Tanner and Luthra, both terrific neurologists. This study is nationwide. Fractures are a big problem for people with Parkinson's disease. Osteoporosis is a big problem, preferentially bigger problem in women. It's a problem in men too, but it's a bigger problem in women. It's a fracture prevention. It's a home-based study. No clinic visit is required. You can read all about it at the topazstudy.org. You can call the 1-800-PD-INFO, or you can just look up Dr. Carly Tanner. She is a world-famous neurologist at the University of California, San Francisco. So the other thing I say to people, and I see some of you maybe have your dogs, whenever I'm talking, and I've talked to an audience of 200, and I ask the people in the audience, would any of you consider not taking your dog for a walk? And no hand goes up. People just would not consider it. So I want to thank you all very much. And the bottom line from this slide is, if exercise is good enough for your dog, it must be good. It must be good enough for you.
Okay, thank you.
Far away with your questions through.
Okay,
Through Sharon.
I have some questions. First of all, I am enrolled in the Topaz study. They tried to, I had one visit from a nurse, but it didn't work. She's coming back next week. They have to do an infusion. And it didn't work the first time, so we're gonna try it again next week. And, but yes, participate in these studies, because if we don't, they can't finish them and we don't get the results. So it's really important that everybody participates. Let me see what questions we had. I think some of these were answered, but let's see. Faye Bomberg asked, what you need a combination of cardio, strength training, and balance. And I think you just answered that. Jane Rigo, would love this study. I'm not sure which one you're talking about, Jane. She meets qualifications, but not near locations. How much is in person versus virtual? Jane, you can unmute yourself. You can tell us which study you want to be in.
So I'm interested in the Sparks study, the third one that he was talking about, but I did a little bit of research before today, and there are a number of locations listed, and I think Atlanta is probably the closest to me, which is, I don't know, 2.5 to 3 hours. And when it says 4 times a week, does that mean that you're supposed to show up in an office 4 times a week? Or is it an exercise program that you follow? What are the specifics for someone? I'm not on any medication, and my diagnosis was a little over a year ago.
Well, the thing to do would be to contact the coordinator, or you can email me directly. So the exercise program is 4 days a week. And so you would have to come into Atlanta to be assessed and do baseline assessments. You would also have to have what is called a DAT scan. A DAT scan serves 2 purposes. One, to confirm the diagnosis. It also allows one to see how the dopamine transporter changes over a year. And we hope that the exercise program prevents it declining. Normally a DAT scan declines over time when you quantify it. At the beginning of the study, we have to make sure that you know what you're doing. So in the ideal world, you would come into Atlanta a few times. Now we've changed the guidelines, and we're also willing to pay for a hotel for 2-3 nights so that you could come in, learn how to do it. The most important thing is that you're really comfortable on the treadmill. And once you've learned the treadmill, once you've learned how to monitor your heart rate, then you basically can do it at a gym nearby you, or we provide you a treadmill, whichever one works best for you. So I would definitely contact us. We will certainly do everything we can to make it feasible for you, but certainly the further you are from either Emory or Morehouse. Atlanta's a big deal for us. We have 2 sites in Atlanta.
Thank you.
And
Okay,
certainly contact me. I'm happy to talk to you more.
Okay, from Lois Alexander, can the Topaz study be done in Canada?
I think so, but you'll have to check. You'll have to contact Topaz and Dr. Tanner at UCSF. My guess is it can, but I'm not certain.
Okay, Lois, you can contact me and I'll give you the contact information if you need it. Mari, to everyone, do you consider exercise at 70% max heartbeat to be vigorous? That is usually given as the goal, not 80 to 85%. Can you clarify?
I don't consider that to be vigorous, no. Okay, now, this gets really, really complicated, so you're gonna have to bear with me. So my job is to give you the science, okay? And then I can guess what happens in between things we don't study. So we studied in Sparks 2, 60 to 65%, and the people on average were at 67%. So they went a little bit higher, and that's because they just wanted to walk a little bit faster. And it was really hard to keep them at 65%. In the new study, we're working extra hard on that. So our data is 60 to 65% and 80 to 85%, and we don't have data on 70%. Now, 70% is closer to 65%, so I think you will not get the same benefit you would at 80 to 85%. But, and I want to be really clear about this, there's a principle of equipoise. And equipoise means equally likely or equally probable. Now, at the moment, the data leans one way, but it's absolutely not clear cut. So the Sparks 2 study was designed to get all the information to inform a phase 3 clinical trial. Sparks 3 is a big study. It's a $30+ million study collecting lots and lots of information. And if that comes out with a clear difference between the 2 groups, then there will be evidence for strong efficacy of 80 to 85%. That being said, you're far better off doing 60 to 65%, 65 to 70. It's all good for you. My job, and what I work very hard at doing, is trying to find the optimal prescription. And for those of you who can push yourself another 5%, now as you get older and as the disease progresses, so I've got a dear friend, well, he's turning into a dear friend. He's 86 and he's finding it harder. And to get up to 80 to 85% as you get older and older, gets harder and harder. So there are a lot of factors here. And so, for example, if you look at Janella, she is all about a really vigorous workout, but not everybody is, and not everybody should be. The single most important thing is consistency. And so do what you like, do what you enjoy. Next question.
Okay, there are actually several related to this. One is the SPARKS-3 study offered at, I guess, at Northwestern. And there was something
I was
else
absolutely offered at Northwestern.
Okay, and how do you know what your percentage is when walking on the treadmill?
But in SPARKS-3, you have a heart rate monitor, and a lot of people work out with heart rate monitors, and they're becoming more and more prevalent. So the Apple Watch has a little heart rate monitor. You can have they're Garmin monitors. There are all kinds of ways to monitor your heart rate. And there's a lot to be said for monitoring your heart rate because it allows you. So you wouldn't think about just putting 4 or 5 pills in your mouth one day and one the next day and forget it for a week. Medicines are very, very, very precisely titrated. And we're trying to reach the point of titrating the exercise dose. And the best way to do it is by knowing what the heart is doing.
Okay. Yeah, I have an Apple Watch, and it's great because it does give you your heart rate, and you can watch it. You know, you can increase your pace or your resistance, whatever you need to do to get your heart rate up. It's great. Okay, are there physical therapists who specialize in working with Parkinson's patients? And would they have had special training or any certification?
Oh, there absolutely are. And you do want to find somebody. If that person wants to contact me, so for example, if one happens to be in Chicago, Shirley Ryan Ability Lab is a rehab hospital, very famous, and they have many physical therapists who are specifically trained to work with people with Parkinson's disease. There are more and more exercise facilities in Chicago. There's a place called the Movement Revolution, and the Movement Revolution is an exercise facility targeted for people who have various forms of disease or disability. And it is good to work with somebody who has a certain experience. Also, the current generation of physical therapists who are coming out, I gave a very similar lecture on Friday to our second-year Doctor of Physical Therapy students. They had to suffer me for 2 hours, and you only had to listen to me for 20 minutes. But the current generation of students are getting the material, but you know, there still is among some people, what's the right word? Not everybody has yet really bought into or has heard about or who understands that this is good for you. It's one of the reasons we did the SPARKS-2 study. There was a question there were 2 questions. The first question was, will people with Parkinson's disease be able to exercise at 80 to 85%? And the second one was, is it safe? So in that study, everybody had a stress test. It was looked at by a cardiologist. So when you sit in my chair and you run a study like this, having people on a treadmill having a heart attack is just really not very good for your own stress levels. And so we were very, very careful we're very careful in all of our studies, but we were very careful in that particular study. And the stress tests were looked at very, very carefully. And there was no evidence at all that people with Parkinson's disease cannot exercise at 80 to 85% peak heart rate. It had previously been shown all the way back in 1971 by Wendy Cortis, a good friend of mine, that women the age of 71, for example, can easily work out, not easy, I mean, it's a workout, but will accomplish working out at 80 to 85% maximum heart rate.
Well, that's good to hear because I'm getting close to that. I'm going to ask you a couple of questions at a time now. What are the inflammatory markers, and do you suggest 30 minutes of exercise at a time?
The second part of the question, I'm not quite sure which part of my talk I didn't make clear. It's 3 to 4 times a week for 30 minutes of endurance exercise is the recommendation. So 30 minutes is good. If you want to do a little bit more, that's good. For some people, it may take a while to get up to 30 minutes. Now, if you go and have a blood test, you will see on your blood test something called CRP, C-reactive protein. You may see something called interleukin-6. There's a whole panel of these inflammatory markers, and one can certainly ask one's physician how well, how far, put it differently, are your values normal? And if they're not, what should you do about it?
Okay, next question. What about exercising on a stationary bike and raising your heart rate level to 80 to 85%? Presumably it would be as good as walking on the treadmill. I would think so.
Well, this is very interesting. So let me answer it two ways. And by the way, for those of you who know Jay Alberts, he's a very good friend of mine. We email each other about 3 to 4 times a week. He's absolutely part of Sparks 3. His site at Cleveland is doing amazing. They've already randomized 9 people. And so I will give you an answer that I think Jay would certainly agree with. Biking is terrific. Now, to really understand Jay's work, his publications which have produced the most striking results are what he calls forced exercise. And here, the person cycles at a cadence of about 90 revolutions per minute. And I think at the moment, and Jay would agree, he's got a grant and he's studying this at the moment. It's an open question whether that 90 RPM, revolutions per minute, is the key variable. He and Angela Ridgel, I think it probably is. I don't dispute it. I just think we just need more science. So where we agree is that cycling is really great. Okay, I'm on a bike. If I didn't have my Northwestern background here, you would see a bike in my basement. So now you're going to ask yourself the question, well, Dr. Corcos, why use a treadmill in Sparks 3? And it's a very, very good question, okay? And so the reason for it are several, okay? I think if you look closely at the literature, the bicycle and the treadmill probably work as well, but the treadmill may have a couple of advantages. So the first one is one reason why dance is so good for one and why it is so encouraged is that people with Parkinson's disease do well with external cues, okay? You'll find that some people towards the end, the most classic example is when you see a person freezing. If you've never seen it before and you haven't experienced it, you have a person who is frozen. And at some point, their feet will just shuffle and it's like their feet have been glued in place. And all the techniques that I'm aware of to help people involve using some kind of a cue. And now the treadmill is a cue. So if the treadmill's going, you've got to go. You have no option. Now you're on the bike and you don't pedal, you don't go. So that is one possible advantage. As a side story, okay, for those of you who do freeze and for those of you who freeze around the house, an Englishman, and you probably have all realized that I'm English, came up with this rather ingenious way of helping him not freeze. He put bits of chocolate all around his house. And anytime he froze, he would kind of glance over. The chocolate was the external stimulus, and sometimes that allowed him to move again. Now, I think the likelihood of 100 people here that a couple of you might like chocolate is fairly high. And if any of you do happen to freeze, you might just think about, of course, the problem if you do that is somebody in your family may appropriate it, in which case you have to make it very clear that that's for you. The other thing is what physical therapists do and spend a lot of time doing is they want a person to be able to transfer an activity from one place to another. So we don't bike that much, but we walk all the time. And so what treadmill training does, you're walking and you're learning to walk. And there is some evidence that the treadmill training transfers better to kind of mobility, because Parkinson's disease is sometimes classified as a mobility disorder. So, you know, these are the kind of things which Angela Original, Jay Alberts, myself, and others will be trying to dissect. There's no question that elite cyclists often pedal at a very high rate. There's no question that if you have a disease in which you're slowing down, you now go into an exercise which makes you move faster, because 90 RPM is fast. There could be benefits. And at the end of the day, and by the way, I have a monthly Zoom call with about 30 to 40 people in which we discuss this. At the end of the day, you've got to find what works for you. And if you're a person who works well on a bike, one of the nice things about bikes is there's all kinds of software to make it great. So most Saturday mornings when it's minus whatever it is in Chicago, I'll be online going down the London embankment, going over Tower Bridge on my bike. And it's exciting and I like it and it works for me, okay? Does not work for my wife. This is about the last thing that she would want to do. Now, she discovered this really nice treadmill in a gym. We were at a hotel and it had beautiful pictures showing you being able to walk through the mountains of Colorado. Worked much better for her. So at the end of the day, people like me will try to tell you what is probably the best from a cardiovascular and neurophysiological perspective. So I kind of consider myself now over time to kind of gravitated to being an exercise neuroscientist. But at the end of the day, what works best for you is what works best.
Okay, absolutely. And Yvonne Garnier-Heckel said she's tried many different sports. She kept yoga in her daily routine, physical therapy and hiking and tennis. And that's, you know, mix it up because you don't want to do the same thing every single day because you get bored and you won't be motivated to do it. Am I right?
Well, that's right. And there's also something else called cross training. And that is if you do the same thing all the time, you know, the last thing you want is to have bad knees or, you know, tennis elbow. Tennis is great, but it does put a strain. And so to be doing tennis 52 weeks of the year may not be a good thing. So mixing it up is absolutely mixing up. You know, it's a little bit like, you know, Italian food's great. I love Italian food. I'm not sure I mean, Italians obviously eat it 365 days of the year, but I think, you know, most people mix up what they eat.
So, okay, I don't have a treadmill, but I have walking poles when I go out and walk with my poles. And I feel like I'm getting a much better workout using the poles than if I was just going for a walk.
Yes, but Sharon, remember, unless I'm mistaken, you can probably do that where you live 52 weeks of the year. I happened to be in LA for the 1 week when it dropped down to like 44 degrees, and one can still walk at 44 degrees. I think some of our friends online, going out today in Chicago, well, yesterday particularly, be hard. So yeah, no, I mean, and there's a lot of this work is done in England. There's a tremendously beneficial effect from being in a green environment. So if you can take your poles and, you know, LA's got some nice parks, it's got some nice, beautiful hills around. If you can get out and do it, I think you get a benefit which is more than just, you know, it's a multiplicative effect. And I think being outside for people is very, very good.
Okay. Couple more questions and then we're going to wrap up. Can you use the urban pulse on a treadmill? I doubt it. And what are your thoughts on swimming?
Swimming's great. Okay. I go to an exercise facility and the aqua classes, most popular thing that I see there. Okay. So why is swimming great? Well, you fall over, what's the worst that's going to happen? You're going to get wet hair and you've got to dry it. You're not going to end up with a fracture. You're not going to end up with any kind of a problem. It takes a lot of pressure off your joints. If one has a slight weight problem, it really is very, very good, because then if one is, walking, it's more pressure on the joints. The flip side, of course, is load bearing is good. So I think doing swimming should certainly be in there. And if you like to swim, absolutely great.
Okay, and what about the elliptical versus the treadmill?
This gets a little bit complicated, partly because I don't think everybody knows how to use an elliptical. So, and it's also the same with an exercise bicycle. You see people who go into gyms and they're going at crazy speed and they're essentially doing no work, okay? So on an exercise bike, you have a device that you can apply resistance. If you've got no resistance, you can spin your legs at 90 RPM and do yourself no good at all. And it's the same on an elliptical. Now, to get your heart rate up on an elliptical is actually a little bit harder. And so you have to look at the incline and you have to look at the resistance. So for example, when I'm on an elliptical, the resistance that I use is really, it's kind of quite high. And if I just go on the elliptical with a reading of 1, 2, or 3, doesn't mean no good at all. So it is less the device that's important, is how you use it. Because at the end of the day, and I can't prove this, okay? And it's a kind of question which people want to know the answer to. And it's a question you're driving at, is if your heart rate is at, let's say, 70% of its maximum, does it matter how you got there? Is there anything different between a treadmill, a cycle, lap swimming, elliptical, Stairmaster? And I think probably not. These studies would be very hard to do because one's looking for such small differences. But I do think it's really important that you and either your doctor or your therapist or your trainer really look at what you really want to help most. And if you are having a mobility issue, then the treadmill does have the advantage that you are practicing walking. Now, it's also true, as Sharon said, if you're outside walking with poles, you're practicing walking. And some of the best evidence for what is good for Parkinson, there are papers on Nordic activities. So Nordic activities are essentially cross-country skiing, and you've got the poles. And that is shown to be very beneficial. So really, what is not good is sitting on a chair or lying on a couch all day. And once you do more than that, you're doing yourself good. And then it's a question of how much good and what really resonates with you.
Okay. The last two questions are both about the 30 minutes and 30 minutes of keeping your heart rate up versus, or plus the warm up and cool down, or does that include the warm up and cool down?
So Sparks 2 and Sparks 3, we have 5 minutes to warm up. It's always good to warm up. I would say if you have Parkinson's disease, it's extra good to warm up because one of the signs of the disease is rigidity. And so my guess is there are times when you're feeling a little bit stiff and warming up is really good. And then if you're coming off 80 to 85% for 30 minutes, you want to let yourself cool down, come back to what's called homeostasis. So a warm up. And then, of course, depending on how much time you add, if you at the end of that, for example, add 10 minutes of stretching and balance, then in one workout, you're getting 2 things in. But that's the classic time frame for Spark studies. 5 minutes warm up, 30 minutes exercise, 5 minutes cool down.
Terrific. All right, we're going to wrap it up here. And
so just to let everybody know, I think what Sharon, did we decide that you're going to call it quits at 1, but if anybody wanted to stay on, then I'm happy to stay on for a bit longer.
If we can stay on as long as, you know, for the next 15, 20 minutes, but I just want to thank you. This has been absolutely wonderful. I will send an email out with a summary. I'll probably do a blog post based on what we learned today with some of your information. And if you have any questions for Dr. Corcos, email me. Do you want to give them your email address, or you may be bombarded?
Yes, to be honest, yes. If all of a sudden I get 300-400 questions in, it becomes a little overwhelming to keep up. That being said, if you have a specific question, don't feel shy about emailing me. But the more we can achieve in the next 20 minutes, the easier it is for me to kind of keep up with my daily job.
Okay, sounds great. And so in a few weeks we have, on February 13th, we have Bradley McDaniel will be talking about finding meaning in your life with Parkinson's. And then at the end of the month, we have Deborah Magid and her son, Zach Grant, who is a filmmaker who filmed her, who produced a film called Shake With Me, and they will be talking about their film and her journey with Parkinson's. We have in March, a couple of our women are going to be doing something on comedy, on laughing. And then at the end of March, we have Crime PD with Stacey Macaluso. Stacey has, if you haven't looked at it, go to Prime PD. They are a virtual exercise center that does pretty much everything that you were talking about. So take a look at their website. There are several others. If you're in the Los Angeles area, Reactive Physical Therapy specializes in Parkinson's. I know there are other places all over the country that are like that. And we had several of our speakers who do exercise classes online. You can look at my past programs and find those, and just keep exercising, keep it up. And I know that it's been hard during the pandemic for many of us to keep up with our regular routines because our classes aren't there. And it's really easy to just let it go. You know, there's too many other things to do, and then it's too late to exercise. But you have to do it, and I see a difference if I don't exercise. And let's just keep working together to make sure that we all live the best life we can with Parkinson's. So thank you. I want to thank you, especially Dr. Corcos, and I hope to see you again next time I'm in Chicago. And for the rest of you, anybody that wants to stay on, you have specific questions, you're welcome to stay on for a few minutes. I know we have a few people on Facebook. You can probably go on to the Zoom call now because we have enough people who've gone off. We can accommodate more. And welcome all of the new people, and I hope to see you again in a few weeks.